Good morning, good afternoon, good evening from wherever you're watching, and welcome to another episode of Something About Surgery. My name is Dr. Stanley Ariel. Now, we have already spoken about the arrangement of a surgical service and the composition of a surgical team. Today, let us talk about the cause of a patient across a surgical service. First off, how does the patient come into contact with the surgeon? The patient comes into contact with the surgeon in two ways, primarily or directly, by walking in and saying, I want to see a surgeon. This happens in not so busy private facilities mostly, or even in consultant specialist clinics in town where you walk in and book yourself to be seen by a consultant surgeon. The other side is through a referral, where a doctor has seen this patient, assessed them to need a surgical consultation, and referred them to the surgeon. And this could be from within the same hospital or from hospitals outside that do not have the specialists. Now, once the patient lands on the surgeon's room, then what happens? The surgeon will take thorough history. They will want to know, what is the problem? How long has it been there? How bad is it? Are there other symptoms associated with this problem? Then they will go ahead to examine you, thoroughly examine you, and focus on the area of interest, and again establish what is the problem. After history and physical examination, mostly we have a fairly certainty of what the issue is, but we still might require to order some lab tests or some imaging or x-rays and scans to confirm what we think is the problem and perhaps to assess how extensive that problem might be. Once we've done all that, then we are quickly able to tell you that you have this problem. It's called a diagnosis. And this is how bad it is. That is called prognosis. After that, the surgeon makes two important decisions. Do you need surgery, or can you heal through medication without surgery? That's the first serious decision the surgeon will make and communicate to you. The second is, do you need to be treated from home, or do you need to be admitted to the wards? Again, whether you're being admitted for medication or surgery is another decision the surgeon will make and communicate to you. Now, what happens when you get into the ward? You get into the ward, if you're coming in for medication, you will be there, the doctors will be seeing you every day, the nurses will be giving the medication, and the entire team will be supporting you until you fully recover. If you are having surgery, you might be going directly to surgery after the encounter with the surgeon. This is called emergency surgery or urgent surgery. Or you might require a day or two to be stabilized, to have this other investigation, to be seen by the anesthesia provider, to be walked through the journey of what to expect and to give what we call informed consent for that surgery. When the day of surgery comes, you will be taken to theater, you will be put under anesthesia, and you will undergo the surgery. And upon recovery from theater, then you are received back to the ward. Sometimes a different room from the one you were in before you went in for surgery, for recovery. And then the recovery duration and extent of support depends on how serious your condition was and how extensive or major your surgery was. After fully recovering from the surgery or the disease that you've been treated for, the doctor then discharges you, they allow you home. But that is not the end, because you'll be given an appointment date. Come in a week, maybe in 2 weeks' time, maybe 3 weeks' time, etc. And this is the time now for the doctor to assess how you're going on, how you're faring. Is there pain? Is the problem persistent? Do you still feel the same way you were feeling before surgery? Are you completely normal? Can you resume your work? This is also the opportunity for us to engage with you in terms of, in case we removed any growth or any tissue and we sent it for analysis in the lab, are the results back? What do they show? And what is the next course of action? Sometimes you just need one return date. Sometimes you might require serial return dates being walked through the recovery journey, but from home, not from the hospital. In a nutshell, that is the general course of a patient through a surgical service.